Hello, my name is Adesumbo Odeseye and I'm a consultant obstetrician and gynecologist. Today we'll be talking very briefly on the common tests done during antenatal care. Now, these tests are very important for pregnant women to do because it helps us make sure that at the end of 9 months we have a healthy mother and a healthy baby. So very quickly, what are the common tests that we do during antenatal care? Usually most of the tests that are done at the booking visit, which is the first visit a woman attends when she comes to receive antenatal care. The common tests that we usually do at this first booking visit will include the PCV, which is the packed cell volume, and it usually assesses the level of blood the woman has at the time of registration so that we can know if she has sufficient blood to care for her and the baby during the course of the pregnancy and be able to treat where necessary. Other common tests that we do at this booking visit will include the genotype and the blood group and what we call the resource factor. As we all know, genotype is very important because it has potential to cause issues for the baby if you have a baby with a genotype that is not very good, such as hemoglobin SS. And hemoglobin SS, if we're well informed ahead of time, prepares the mother and her family to take care of the baby. The other very important blood test that we do, like I mentioned, is the blood group and resource factor, so that's to prevent what we call a resource disease or resource isoimmunization. Very commonly, other tests that we do during the booking visits will include the HIV testing and the hepatitis B and C testing. These are viral infections that can be transmitted from the mother to the baby during the course of pregnancy, labor, or delivery. And if we are well informed of these tests ahead of time, we can treat and reduce the risk of transmission from the mother to the baby. Other tests that we also do as well, we also screen for what we call syphilis, and the test we do for this is called the VDRL, which is known as the Venereal Disease Research Laboratory testing, that we check for syphilis. Because if a woman has syphilis during pregnancy, the potential to give her baby congenital syphilis is there. So as we can see, most of these tests we do is targeted towards ensuring a healthy pregnancy for both the mother and the baby during the course of pregnancy. Now, aside from this common test that we do at booking, the other tests that we do at different points in pregnancy will include, at every visit, a pregnant woman will have her urine tested to be sure there is no presence of protein or glucose, which has implications for the care of the pregnancy, vis-a-vis when we talk about hypertension diseases in pregnancy and when we talk about diabetes mellitus in pregnancy. So at every visit a woman attends for antenatal care, these are two tests that will be done on the urine. In addition, the blood pressure is also checked at every visit in order to track the possibility of hypertension in pregnancy. Now we'll talk about ultrasound scans. Ultrasound scans are done at different points in pregnancy. At the booking visits, we usually do an ultrasound scan which we call it a dating scan. The dating scan is very important because we need to know the age of the pregnancy, and it helps us to track the growth of the pregnancy throughout the course of the 9 months. And so usually at booking visits, the dating scan is requested and is done in order to know the age of the pregnancy. Then at different points in pregnancy, depending on your gynecologist, will ask for scans. The other scan that is important that is done is routinely done at 18 to 22 weeks, and this is known as the anomaly scan. The anomaly scan is a scan that is done to assess the baby in utero to determine if there are any structural abnormalities with the baby. This also helps the parents and the obstetrician managing the pregnancy on how to care for the baby if any abnormality is present. Thank you.